Hi, my name is Ashley, and today I will be demonstrating how to set up for a PFM crown insert. Before we get started, I'd like to show you the different types of restorations for your tooth. The first one is a veneer. A veneer is more for a cosmetic reason, for closing up a space or if you don't like the shape or size of your tooth. Then you have a Emax crown. A Emax crown is a white metal with porcelain baked on top. Then you have an Empress crown, which is good for front teeth because they are more translucent. You also can have an onlay. An onlay is good if a quarter of your tooth is missing. A gold crown is more for people that have a heavy bite. And a PFM is a porcelain fused to metal and is used for posterior teeth. Each type of restoration has different kinds of cement or bonding systems. Today, I will be showing you how to set up for a PFM crown insert. Before you get started, you want to make sure that your room is clean and you have a pair of clean gloves. Knowing that every office is set up different, I went ahead and laid out all the items that we will be needing for today. You will need a tray cover, 2 pairs of gloves, 2 napkins, a headrest cover, 2 face masks, a needle recap holder, your cassette with all your cassette instruments, topical, your 3 polishing wheels, a mixing pad, your hemostat, your scaler, your spatula, an extra Q-tip, you'll need a needle, your anesthetic, rubbing alcohol, dipping dish, your cement, which today we'll be using Reliax, your slow speed, your high speed with a mama burr, your patient model with their crown, and a basic tray setup. This is the doctor's area. For today, the assistant will be doing most of the work over here. So you'll need a tray cover to cover up the tray, a mouth mirror so that way you can look inside the patient's mouth. You'll need an explorer so that way you can make sure that the crown is nicely tucked underneath the gums. You'll need an articulate paper with its holder so that way you can check the patient's bite. You'll need another scaler so that way you can check to make sure that all the cement is removed from the crown. You'll need a piece of floss so that way you can floss in between the teeth to remove any excess cement. A hemostat so that way you can take off the temporary crown. An air water syringe so that way you can rinse the patient's mouth and also dry off the tooth. A slow speed with your 3 polishing wheels so you can polish the porcelain. And you'll need your high speed with an old mama burr on it so that way you can adjust the bite and the fit of the crown if you need to. Next, we will be setting up the assistant area. First, you'll need to put on the headrest cover, and then your napkin with your 2 pairs of gloves, 1 for the doctor, 1 for the assistant. You'll also need to set out your 2 face masks, 1 for the doctor and 1 for the assistant. On the napkin, you also would like to put your patient's model with its crown. Next to it, you'll want to set up your needle recap holder with your syringe and your needle. You have two different types of needles to choose from. You have a small blue needle and you have a yellow big needle. The small needle is for upper teeth or for children 15 and under, and the yellow needle is for lower arches. Since your crown is a lower tooth, you'll need to use the yellow needle. So then you'll place the yellow needle into the syringe and make sure it's securely on. Next, you'll want to set out a piece of gauze with your Q-tip. You want to put some topical on it. This topical will be placed on your gum where the needle will be injected into to help ease the numbing. Also, you'll want to set out your anesthetic, which today we will be using mepivacaine. Next, you'll want to set out your other napkin. On this napkin, you want to place your mixing pad, your cement, and your spatula. You'll be taking the cement, just put it on the mixing pad, and you'll be mixing it together, and then you'll put it on the crown, inside the crown for the doctor, so that way she can insert it into the patient's mouth. Next, you'll want to set out your rubbing alcohol, your dipping dish, and your extra Q-tip. This is used to disinfect inside a crown and the patient's tooth. Next, you'll have two different pickups. One pickup will have a rubber band on it and the other one won't. The one without a rubber band will be used to transport any items that are contaminated, which we'll place that one on the tray. The pickups with the rubber band will be used to transport any items that you don't want to contaminate. Next, you'll want to put on your small suction, which is used to help suction any extra saliva or help with any rinses. Then you want to put on your other air water syringe. And then your large suction, which is useful for when you're taking off the cement. It will help suction any of the cement instead of having the patient swallow it. On your basic tray, besides your pickups, you'll want to have gauze, which is used to wipe the patient's mouth when you're done with the procedure. Also, you can use it to wipe off the mouth mirror when it gets a little dirty from the debris in the mouth. Also, you'll want some cotton rolls, which you will use to help keep the tooth dry. And also, when you are cementing the tooth, you'd like to have the patient bite down on the cotton roll so that way it helps to apply pressure to the cement while it's drying. Finally, you will have the patient's bib. This patient's bib is used to help protect anything that might splatter on the patient's clothes. That is it for my demonstration on how to set up for a PFM crown insert. I hope this helps.